Hi, and good evening, everyone. Welcome to the webinar on equine acupressure for the support and rehabilitation of musculoskeletal problems. So for those of you who are joining here the first time, we use for communication the chat function. I ask you to stay muted and turn the video function off. We will have time for question at the end. If you have questions during the presentation, you can put them into the chat function. And I will answer them at the end, but I will also keep an eye on it. So if it fits in, I may answer them straight away. Also, there will be a replay available and downloads, which I will send you a few days after today. So there is Ria. I think I'll stop your video again. Wait. So, okay. So we go on. So the musculoskeletal problems are such a vast field. So we just really can look at a few things today because it's a very wide area. And we will have a quick look at the anatomy of the musculoskeletal system from a Western perspective. And I know that there are a few therapists here, so this is very basic for you, but it's just because the webinars are targeted to horse owners as well. So just, I would like to include a bit or to recap on it. And then we look a bit at rehabilitation, and then the musculoskeletal system from a TCM perspective. So which meridians and organs are relevant or particularly relevant when we have problems in the musculoskeletal area. And then we finish with a few acupoints that you can use if there are any issues, and when to with what issues you best use them. I actually have quite a number of points compared to the previous sessions today. And then we finish with questions and answers. So the musculoskeletal system. So the musculoskeletal system is an organ system which is responsible for movement and support of the body. And there is, of course, the muscles and the skeletal system. And it is also known as the locomotor system because of its function, that it is basically, it's the basis for our, the horse's ability to move forward. And apart from muscles and bones, there is cartilage, joints, tendons, ligaments, and fascia. So, and muscles are a distinct type of body tissue, whereas bones, tendons, joints, ligaments, and fascia are all types of connective tissue. So, and the skeleton is the sum of all the bones in the body, and there are around 210 bones in the equine skeleton, and they are very variable in structure and form. I mean, we see that here, the scapula, the humerus, and then the ribs, and it's quite varied and has different characteristics. They are connected to each other with fibrous or cartilaginous tissue, and the connections between the bones are the joints. And we will see how the TCM fuse that aspect as well. The skeleton gives the body its form, but it also protects the inner organs. And of course, in connection with muscles and ligaments, allows movement. And it also has a big function in the storage of minerals due to the way the bones are made, because they are highly mineralized. And then they are also due to the bone marrow in the bones responsible for the production of red and white blood cells. So there's many important functions and and aspects that are really essential for being able to function properly. So the muscles, oops, oh, going back there. So the musculoskeletal, yep, there we are, is an organ system that consists mainly of individual muscles. And through the process of contraction and relaxations, it causes the movement of the body and of structures and systems within the body. And it's the basis of the active locomotion and the driving force behind many bodily functions. So the proper working of muscles is basically a requirement for the movement of the horse and for the activity. And it's, I mean, we know ourselves when the way, if we train and our muscles, the better they are trained and built up, the easier the certain movements are. And approximately half of a horse's body weight is muscle. And of these muscles, roughly 90% are involved in movement and locomotion. So, and then we have tendons and ligaments and fascia. Tendons are strong bands of fibrous tissue which connect muscles to bone, and they are connective tissue. And there are very few blood vessels within a tendon. And also fascia are a type of connective tissue. And they are very similar to tendons, but instead of being formed as a bundle, they are broad flat sheets of tissues, and every muscle, they enclose muscles. And then there are ligaments, which are also strong bands of fibrous connective tissue. And ligaments connect bones to each other in the region of joints. So they have an important function in relation to joint function as well. So, and rehabilitation, which is often a huge factor when we have musculoskeletal problems, injuries, how to basically find a good way and protocol for the horse to recover from injuries or any other problems. And that really is teamwork. So the better the team works, the better the result. So acupressure, for example, is something that you can apply to support rehabilitation and any musculoskeletal problems, but it's only one part of the whole picture. So we have the equine therapist, so that may be the acupressure practitioner and the acupuncturist, but also the osteopath, physiotherapist, and any other manual therapists and body workers, the vet, then the owner and or the trainer are very important. It's often very essential for the success of any rehabilitation efforts that the owner and trainer play their part in rebuilding and rehabilitating the horse. Any other health professionals, the farrier, of course, because I mean, there's so many issues could be avoided with proper feed management. And then the patient, of course, the horse. So, and it is essential, or I mean, it's sometimes hard to accomplish, but it's quite essential to have the same goals and ideas in the respect of the rehabilitation process, also in terms of time, cost, the stages of treatment, and any risk, for example, of re-injury. And also it requires an individual treatment protocol. We often tend to basically have a one size fits all. So there's this issue, so we'll just do this and this and this and that. But actually the best results are achieved if we look at the individual particular situation and then we work from there, because there is just no cookbook or no recipe. So that's the same with basically proper acupressure and acupuncture work. We do a bit of recipes here, but if you need to go a step further, you should not work from a recipe, but you need an individual assessment of the particular horse. So, and the musculoskeletal system from a TCM perspective. We'll start with the 5 elements first. So the ones of you who joined the first, I think, yeah, the first webinar, you may remember we had a look at the 5 elements. And the 5 elements play a big role in traditional Chinese medicine, and they can be applied in many different ways. So, and certain different practitioners put different emphasis on the application of the 5 elements in their practice. So you can use the 5 elements for diagnosis, but you can also use them. You don't have to put that much emphasis on it, but you can. But you can also use it very much in your point selection. And where it's relevant for us today with the musculoskeletal issues, there is, just wait a second. We have the elements here: metal, water, wood, fire, and earth. And then we see this row here, the body parts. So, and with the water, the kidney and the bladder, we have bones and marrow. Associated with wood, liver and gallbladder, we have tendon and ligaments. And then we have the earth, the spleen and the stomach, where we have the muscles and the lymph. So those 3 play a major part when it comes to musculoskeletal issues. So if there are tendon issues, you most likely have an imbalance on the level of the liver and the gallbladder involved. If we have joint issues, we basically may address the bone function, and we may work with the kidney and strengthen the kidney. And muscles, we have spleen and stomach, but we will look at that in more detail just now. So the spleen meridian is the spleen, and P is the Chinese name for spleen. Also, when we speak of the organs in Chinese medicine, like the spleen here, or the liver, or the kidney, or any other organ, and meridian, it does include the organ, the anatomical and physiological, with the physiological functions from our Western perspective, but it also includes much more. We just don't have really any words in our language that that does fully reflect what the Chinese mean by it. So just to keep that in mind, because there is just more associated with it than in that way of thinking than the way we approach it. So the spleen governs muscles and the 4 limbs. That means the spleen nourishes muscles through Wei Qi and Yin Qi, and indirectly through blood. So that means there is a lot of processes. We spoke about it in the first webinar. So Qi, which is translated as life energy, does enter the body through food and the breath, the air, and then in the body it goes through different processes and transformations where the organs and the meridians, they are involved in that process, in those processes. So the spleen has a very big function when it comes to the transport and transformation of qi in the form of Wei Qi, which is defensive qi, and Yin Qi, which is nourishing qi. to basically transport it in a way to transport it to the muscles and to nourish the muscles so that they can properly function and properly work. And also the blood, xur in Chinese, which where the spleen also plays a major role in transformation. And again, the term blood does include the blood the way we understand it, but also a few more functions in the Chinese understanding. So if a horse has a weak spleen qi cannot be transported to the muscles, and which then results in weak and atrophied muscles. So we need to support and strengthen spleen qi to keep muscles properly functioning and to help to increase their strength. But when it comes to the flexibility of muscles, then it's the liver, gan in Chinese, which is responsible. So to keep that in mind. So muscles, first we think of the spleen, but then when it comes to flexibility, the liver is involved as well. So here we have the flow of the major meridian spleen. So it starts here, caudomedial on the coronary band, and runs up the leg, turns inward, and then here runs forward and goes back here and ends with spleen 21. That's the meridian. So for those who attend the first time, there are 12 major meridians in Chinese medicine, like for example, the spleen, and then there is the associated organ, the spleen. And those meridians, the 12, they run over the whole body in different ways. We have a look at a few of them today, and they run on both sides of the body. And through the acupoints, which are on the meridians, we can basically then address any imbalances. There are also certain acupoints which are not on a meridian, just as an additional information. So, and then we have the liver meridian, gan, and the gallbladder, dan. So if you are wondering now why there is the gallbladder, whereas the horse doesn't have a gallbladder, that's basically because in Chinese medicine, what we said before, that the functions go far beyond our understanding of the anatomical organ. So even though the horse doesn't have a gallbladder, there are all the other functions from a Chinese understanding that the gallbladder has. So that's why when we work with horses, we also work with the gallbladder in traditional Chinese medicine. And the liver controls the tendons that are nourished by the blood of the gallbladder. So that's where you see both of them are involved when it comes to the tendons. And the mobility and activity depend on healthy muscles and tendons. So therefore, imbalances in the liver and or the gallbladder can manifest in tendon injuries or muscle cramps, for example. So, and here we have the liver meridian. It also starts on the hind limb, medial, but craniomedial, and it runs up here, turns inward, and then comes here and ends here with liver 14. then the one for the gallbladder. The one for the gallbladder starts here at the outer canthus of the eye, goes here, and then just between the ears, all the way down the neck, over here, there, and then all the way down the hind leg. And it ends craniolateral on with gallbladder 44 on the coronary band. So all the 12 major meridians either start or end on the coronary band. So there are 6 major meridians that end or start at the hind foot, and 6 that either end or start at the front foot. So, and then we have the kidney in relation to the bones. So the kidney produces marrow and rules over the bones. Also, teeth in TCM are considered to be related to the kidney as part of the bones, and hooves in Chinese medicine are considered to be an extension of tendons. So they basically would be related to the liver and the gallbladder. So, and the meridian of the kidney starts caudal and runs up here, goes here, and then it flows on the abdomen. I have another picture in a moment, and ends here at the chest, just with kidney 27. But I have it here. So it flows up here, and then it runs over the abdomen and ends actually just here, just above the muscle. This is a bit unfortunate. I just realized it myself yesterday because of a question during the German version of this. This is actually, this would be the one on the right side of the horse, but actually this is the meridian on the left side. So the extension of this meridian would actually run here on the right side. And the part for this one would run medially, start caudally, but then go and run medially on the left leg. So, and are there any questions right now? Because we could, before we start with the points, we could add a few of them. But if there aren't any, I just move forward. So before we start with the acupoints, I just would like to you to take note that there are a few contraindications. So do not apply acupressure on infoal mares, because there are certain points that can cause abortion. It doesn't mean that we can never work with TCM on infoal mares. It's just you need to know what you're doing. Then directly before or after feeding hard feed. Also sudden behavior changes. You want to make sure that there is no underlying physical issue before you address it. And any emergencies, please call the vet. And I've touched on that before. It's what we do now. We work with a few points because it's a good way to get started with acupressure and to see the benefits of it that are quite common for certain indications, certain Western indications. But it is not the same as a qualified TCM therapist would do, and it doesn't replace a proper assessment or diagnosis by a TCM therapist, because they would look at the individual horse, and horses can present with very similar symptoms, but when you treat them with TCM, you may basically select different points for both horses, because when you do the proper assessment, there may be other points that are more beneficial. With the points we look at now, you can support all the things that we will add to them, and you won't do any harm with working with them, but you may just not have the best point in that certain case. So it just may not be as effective. And we will start with the association points. Again, we had them in the very first webinar and looked at them. Association points are a group of acupoints. There are different groups of acupoints in TCM with different characteristics. And the association points, also called shu points in Chinese, are generally both used for diagnosis and for treatment, because there are 12 of them. So they are basically connected with the 12 major meridians and organs. So there's one shu point for each major meridian and organ, associated organ. For example, bladder 13 is for the lung, 14 for the pericardium, 15 for the heart, and so on. And the ones we will pick now are the ones for the spleen, the ones for the liver and the gallbladder, and the one for the kidney, and also the one for the stomach in relation to the spleen. I will add to the downloads later a more specified description on it. So don't worry, like what we go through now, I'll put it there in writing so you can refer to that then. So we have the one for the spleen is bladder 20. It is in the last intercostal space. And the one just after, behind the last rib, is the one for the stomach, bladder 21. So if you have any muscular issues, that would be 2 points you can work with. Then we have bladder 23, the ones who were here for the immune system may remember we worked with, the respiratory issues. We worked with bladder 23 as well. And you find bladder 23 at the level of the caudal border of the rib cage. So the best way to find the shu points is, especially those, to orientate yourself on the ribs. So the horse has 18 ribs. You can find the last one, the end of the rib cage, and from there you can basically move forward to find the one point that you want to locate. Bladder 18 is the one for the liver. It's in the 13th and 14th intercostal space. There are actually 2 points. So there's 18 and there should be another one here. And bladder 19 is the one for the gallbladder, which is in the 15th intercostal space. So we go to them again. Bladder 18, the one for the liver, and bladder 19, the one for the gallbladder. So these points you could use if you have any tendon and ligament issue, but also if there is problems with flexibility of muscles. Then bladder 20 and bladder 21, the spleen and the stomach, particularly for any muscle issues. And then here, bladder 23, the one for the kidney, if you have bone problems or joint issues. So these are 5 points that you can use particularly to address any issues in the musculoskeletal system. So, and as I said, I will add more detailed information in the downloads to make it easier for you to work with this here. Because from here, I have this, which shows you how to locate bladder 23, the association point for the kidney. So you find the end of the rib cage, and from there you go up in a straight line, and you find bladder 23, which is 3 soon lateral to the dorsal midline. So it's 3 soon, and I will say something about soon in a moment, from the dorsal midline. So basically the midline that runs over the whole back. Soon is a Chinese measurement, and it can be taken on different body parts. 3 soon, the bladder meridian, they are all the points we have looked at just before. They are all 3 soon from the dorsal midline. And 3 soon often is approximately 6 finger width or hand width. But you can also take the distance of 3 soon from when you get the distance at the upper part of the scapula. I will add a picture that makes it clear in the downloads. So if you start working with it, taking a hand width or 6 finger width, and also develop a feeling for where the acupoints are, because the description, the anatomical, and also the soon measurements can always only be an indication, but there are usually very small indents, depressions where acupoints are. So with practice, you are actually quite able to feel them. And so that's just your guidelines, how to locate them, especially at the start. But this will be added to the downloads, so you can, and also I will have additional video material in the downloads to locate these and the other points that we are going through just now, so you can refer to that. Right. So, and we'll continue working a bit on the bladder meridian tonight. So we have another one on the bladder meridian, and this is bladder 11. And this is the influential point for bones. So like bladder 23, the association point for the kidney, especially bladder 11 is especially a point to work with if you have any bone issues and joint issues, but also pain and stiffness of the neck and spine, shoulder pain, and general muscle soreness. Shoulder pain because it's a local point. So we always can work if we have, for example, if you have a shoulder problem, you can always work with points that are close to that. And that is also here with gallbladder 21. And that applies to any problems. When you have a problem in a certain area, in addition to points that are indicated for that problem, you can always make use of points that are around the problem area. So, and this point is 1.5 soon lateral to the dorsal midline. So you see that bladder 13 would be 3 soon lateral to the dorsal midline, and bladder 11 is 1.5 soon. So that would be roughly 3 finger width, but as you see here, that's just a rough guideline. So you would need to take the distance, or would need to see it at the specific individual horse. And we have another one on the bladder meridian. And this is the master point for the back and the hips. So this is a point because it's there are a lot of many horses with problems, especially in the lower back area. So this is a good point to refer to when you have problems in those areas, but also any hindquarter issues, but and especially also the stifle, but you can always also make use of the flow of the meridian. So with working with bladder 14, which is the master point for the back and the hips. So you basically, it's a good point to address any issues in that area. But you also see, because when you work on that point, you influence the whole meridian. So that's why you can see that this is a good point if there are any problems in the hindquarter as such. And it is at the midpoint of the transverse crease of the popliteal fossa between the semitendinosus and the biceps femoris muscles. So, and then we have the gallbladder, because as we've seen before, it's very relevant when it comes to tendon and ligament issues. And this point is actually the influential point for tendons and ligaments. So it's a very good point to work with any tendon issues you encounter. But also lower back pain, hindquarter issues. That's again because of the location and the flow of the gallbladder meridian, and also muscle cramps or spasms. It's at the interosseous space between the tibia and fibula, between the long and lateral digital extensors and craniodistal to the head of the fibula. There you would really need to make yourself familiar with the anatomy beneath it. And I will add in the downloads again an additional image also with the bones beneath it to make it a bit clearer. But this to locate, sorry, this is the point actually, excuse me. This is gallbladder 34, the green point. You need to make yourself familiar, and it's a bit of practice to palpate the structures to locate these points. So but if you become aware of what is beneath there, it's usually no problem. And again, you feel the little indents where the point is. And we also will look at another one at the gallbladder meridian, which is gallbladder 39. And this is the influential point for marrow. So even though it is now a point on the gallbladder meridian, and we have spoken about tendons and ligaments in that regard, because this point is the influential point for marrow, you can very well use it for any bone problems. And in addition to the, for example, bladder 11 or bladder 23. And as a local point, it's a good point to work with for any hindquarter issues, but also, of course, hock problems as a local point again, and stifle issues. And this is a bit easier to locate because it's 3 soon above the tip of the lateral malleolus. Anal depression on the caudal border of the tibia, cranial to the lateral digital extensor. So if you start orientating yourself to locate it at the lateral malleolus, you can very easy locate it. So, and this will be our last point for today. And some may remember it because we already had it in with when we addressed the immune system. So stomach 36, it's actually a point that can be used in many, many different under many, many different circumstances. So there is immune stimulation, gastrointestinal problems, because it is the master point for it. So any problems in that area, including ulcers, stifle problems as a local point, but also asthma and cough, and for muscle problems, because it is very efficient to work with when the spleen is not able to fulfill its function of transporting and transforming qi. Then this point is a very effective point to work with. So maybe in addition to bladder 20, if you have problems in that regard, so that you have muscle atrophy or muscles are not properly building up, even though you are putting in the work, you could use bladder 20 for the spleen, bladder 21 for the stomach, but also stomach 36 to address it, because it benefits and strengthens the function of the spleen of transporting qi to the muscles and to nourish the muscles. So, and this one is in the depression just lateral to the distal aspect of the tibial crest, craniolateral on the tibia. So you basically, to locate it, it's easy to find the patella, and from the patella you palpate your way to the tibia and the tibial crest. And that's actually one of the points that are very much contraindicated during pregnancy. So this is really a point to avoid if you are dealing with infole mares. So these are the points that I wanted to introduce you to today, because with these points you kind of have a set of points that you can use if you have any musculoskeletal issues in any way or form. But of course, if you have a specific problem and you really want to go, you probably need a proper assessment for it. And before we finish, I also would like, it's a repetition for the ones who were here before, but for the ones joining the first time, I'd like to introduce you to two basic techniques for the point work. And we work on the points with our fingers. So there's the thumb technique, where you apply pressure, but when I say pressure, it's really, really gentle. And I usually start more with holding the point with the tip of your thumb in a 45 to 90 degree angle. And as a guideline, because there's usually the question how long, you start with slowly counting to 30, or maybe start up to a minute. But generally with practice, you develop a feeling on how much work a point needs. Also, I also recommend it to work with the amount of pressure you should apply, work with the horse. Every horse is an individual, and basically develop that feeling how much pressure is needed. So there's never really a strong pressure. So it's really gentle work, but it depends a bit on the animal how much, and also the situation and the problem and the condition. And also there is often the question, what is if there is a point where a horse is resisting, and where you have mm, that may be a bit tense or painful. I like for when it comes here to the very basic work and beginners work, I really want this work to be comfortable. So I don't recommend to work on any points which may be triggering resistance in any way or form. But this, of course, does not, because I think you should be a qualified therapist, so you know what you're dealing with. I'm just adding this now because I know there are maybe physiotherapists or osteopaths who might like to add a bit of acupressure into their work, and you are of course working from a different you work in a different way, and that's fine then. But generally we don't work on points that cause any severe reactions. It should be gentle work. It's comforting for the horse, and any other work should be with qualified therapists to address when there are any issues. And there's the 2-finger technique, where you work on a point with your index finger. So you put again in a 45 to 90 degree angle to the surface of the horse, and you put your middle finger on top of the index finger. And again, the same applies as a guideline at the start. Count to about 30, but generally really practice and develop a feeling for how much pressure should be applied or is needed. So yeah, this is what I had to tell you. So if you have any questions, please put them into the chat box. What TCM books do you recommend? It depends what you want. So for acupressure and equine acupressure, there's very good material from the Tollcross Animal Acupressure Institute. So they also have a book on and an app actually, but the book is quite good on acupressure on horses, where there's also basic theory on TCM. So it's very nice material. The only thing really I have you probably need to apply a bit of caution with their point charts. It's really unfortunate because otherwise their material is so yeah, good and structured and understandable. The point chart uses a horse in movement, but we usually work on horses that are standing. So you always have to keep that in mind if you see the picture and where the point is located. Then there are general TCM books. For the general theory, you can refer to human terms. There is one book, A Web That Has No Weaver. The author is Ted Kapchuk. That's one of the very basic usually study material that is recommended in different schools and institutes. And then there's things when you want to go deeper into depth of TCM theory. And also you can, even though you only apply acupressure, you can also refer to acupuncture books, because there is not so many material and literature on acupressure, especially in the equine world, apart, for example, from the tall cross material. And there's, I think Diana Thompson is her name, but I actually don't know her book. And because the theory and the meridians and the points are absolutely the same in acupressure and acupuncture. The only difference really is that you work with your fingers in acupressure, and that you apply needles in acupuncture, so you can work with acupuncture material as well. I have a red light. Do you like these 4 points? I don't know, because I have no experience working with it. I would be interested if anybody has an experience with it, then I'm happy to hear more, because I don't know. And back to the literature, I may add a few resources in the downloads, so you can refer to them. When working on the points you have shown, do you also advise to use the ting point of that meridian at the end of your work? If you know, like for anybody else, the ting points are the points I spoke about, the end and the start and the end points on the coronary band of the meridians. These are called the ting points. And at the end of your work, if you know and if you are familiar with the ting points, you can incorporate them into your work as such. Not necessarily only at the end. It's just because I'm kind of limited here with my time, and I just want to give a bit of an insight. So we can only cover so much, but if you are familiar with them, incorporate them in your work. It is called an Aculight. The horses all respond really well. Okay, that's nice then. So I think sometimes it's especially, I think if you can work with your fingers, but there are sometimes points that are at locations that you cannot really you cannot work on with your fingers, or you cannot stick a needle in that easily. And also sometimes you have horses that don't really like, especially with acupuncture, not every horse really is very keen on having put needles in it. And I think it's a good way then to work with red light on those points. Actually, also, I forgot, because we are in with the more the audience here in English speaking countries. I'm based in Germany, and we have legally, we are kind of quite an exception. I think in Sweden it's similar. In Germany, you don't need to be a vet to apply acupuncture on horses or other animals. And you also are allowed to diagnose. So I know that the situation is very different in, for example, the UK and Ireland, just as an additional information. Yeah, okay. So I do not use the red light around the eyes. Yeah. Are there any other questions? Also with certain conditions. So with the points I showed to you today, for example, I've given you quite a number on the bladder meridian. If you work on a horse, I wouldn't use all these points in one go. Because the moment you work on a point on the bladder meridian, you influence the whole meridian. So I would, for example, pick only 2 or 3 on the bladder meridian, the ones that maybe are the ones best suited. And you can also try what points your horse responds best to with the signs they give to you, that they release, relax, etc. But I would not choose for one session more than 2 or 3 points on the same meridian. And in general, I think it's fine, choose 3 or 4 points. You don't need to overdo it, and then work with those points also on both sides of the horse. For example, if you address muscular issues in general, then it makes sense to work with the points on both sides of the horse. Whereas maybe you may only want to work on one side if you have on the one side a problem in a certain areas, then that's fine. But you can still use the points on both sides. Any more questions? So if there are no more questions, I will just finish it by, as I said, because I think the most difficult in this setting is basically I leave you with a set of points, and you may or may not know what to do with it. So as I said, I generally for you may have a certain issue, then you may pick the points that we cover today for that may be suited to that issue, and then work with your horse and see. It's always, to me, acupressure and acupuncture, it's always communication with the horse. We always work with the responses of the horse. We also want the permission of the horse to work with. So it's not it's communication. And then maybe if you basically through this communication you find out what points the horses responds to in the best way, and then you can work with them maybe every other day. And for example, also as a general support, or to address certain issues. But of course, if you have a particular issue, the ideal and the best way is, of course, to have a TCM therapist getting an individual assessment, and then giving you certain points that you can apply in between, because that is what I would do when I treat a horse. I treat the horse and then I leave a few points to the owner that they can continue to work with or work with in between sessions. So yeah. And if there are no more questions, I'd say we'll finish here, and I will get the video, the replay, and the downloads ready, and I will then send you a link with it as soon as it is available. And I thank you for the attention, and some of you I will see next week. Bye bye.